Mental Health Monday on Radio City Talk. Tackling the stigma.
It's Mental Health Monday, back for another week from Radio City Talk. My name is Mick Coyle. Thank you for checking us out. Show a little bit different today. We're going to pick up on some stories we've been talking about over the last 7 days or so. Big news stories and another story as well, and a family story off the back of a suicide in really tragic circumstances. It's all on the way as part of this week's Mental Health Monday, which every week here on Radio City Talk takes a look at mental health issues and tries to discuss them in an open and honest way. If you'd like to get involved in the programme, you can do. Simply drop us an email, mick@radiocity.co.uk. That's mick@radiocity.co.uk. In a few moments' time, you're going to be hearing from the Wavertree MP Luciana Berger. But first, there was a story I was discussing with my panel as part of Friday's Radio City Talk Liverpool Live. And we were discussing new figures that came out about whether or not children were able to get the help that they needed when it came to their mental health. It didn't make for great reading, as we discussed with the panel, Steph Heneghan, Mike Hussey and Peter Oliver, who all joined us on Radio City Talk.
Liverpool Live, the panel on Radio City Talk.
I'm going to touch on a story now. Here are the figures. A review has found 2 out of 5 mental health services, 4 out of 10, for children are failing and they're facing long delays for treatment. The Care Quality Commission says the service youngsters get in England varies across the country. Some get seen within 35 days, just over a month, whereas others can wait for a year and a half. Just looking at some of the details contained within this one and a statement from Matthew Reid, Chief Executive of the Children's Society. Vulnerable children in desperate need of help are facing agonising waits for treatment, in many cases without anyone checking in on them to make sure their condition isn't deteriorating, leaving families at crisis point with no one to step in and help. Even worse, many children struggling with their mental health do not even make it onto the waiting list. The Children's Society's own research has found that 30,000 children are being turned away from mental health services every year and not receiving any support or treatment whatsoever. Steph, I know that this is something that you're really passionate about. Peter, you work within the scouting organisation, so you're dealing with young people all the time. Mike, you're a teacher, so obviously you see young people on a day-to-day basis. You know, hearing about a postcode lottery, you know, for some people, waiting 35 days for a sit-down session, for a treatment session to get underway would be too long. But that, Peter, is the best case scenario in this particular scenario that we're looking at.
Yeah, and I think this is going to become a growing problem, and it's something that we will definitely going to need to face. You know, that I think young people face challenging times, and I think it's our responsibility, society's responsibility, to make sure that the right support services are in place and to make sure that young people who need support with mental health issues get that. Now, I think actually the way to try and improve the situation starts much before any young person is at risk of actually experiencing problems with their mental health. I think it's about how we help build resilience in young people, mental well-being in young people, improve stability, improve emotional intelligence, all of those aspects of it. And I think we've got a responsibility, society, government and charitable organisations to try and make sure that young people are given the opportunity to develop better resilience.
If we talk about that being the first stage that people might come face to face with a mental health service, just so you know, the report also shed lights on how children are still being let down once they get in treatment. The CQC found that 2 in 5 community services are inadequate or require improvement or to effectively respond to children's needs. Analysis as well found that children missed 157,000 mental health appointments last year, and that many missed appointments were not followed up by health professionals to check that the children concerned were safe and well. Steph, this is, you know, a problem to get children through the front door in the first place. Problems then once they get in the front door or for whatever reason don't show up at the front door as well. This sounds like a mental health service where it's a postcode lottery. It doesn't, no matter where you are in the country, you'll get a different service. There's not a joined up approach, and it's a concerning picture, isn't it?
Yeah, it is. Postcode lottery kind of makes you think that some areas would have it better than others, which I suppose is true to a degree, but I think resource for mental health, there's such a heightened awareness of mental health just across the board. So if there's an awareness of it, we should also be following up with the resources to provide the care for that, and that's just not there. And so that's something that it lies at the government. You know, it's Theresa May has said recently about the importance of mental health. Well, you need to put your money where your mouth is, because so much of the work done is done by agencies such as Childline. It was an agency I work with through my day job, an NSPCC, and they support to a degree. But in terms of actual medical help, the resource isn't there, and the following up appointments again. It's not a case of they're not bothered. It's a case of they literally do not have the resource to follow up appointments, and they're the kids that you need to focus on. The kids that are skipping appointments, but they're the ones that fall through the cracks. And it's
an
really
interesting
sad.
point about where the responsibility lies, though, isn't it? Because the NHS faces, with its current funding plans, faces something like a £30 billion funding gap with the services it delivers today alone by 2021, I think it is. So unless we do find a way to invest more public money in allowing the NHS to extend the services they provide, there's no way that they're going to be able to
It's
help.
an end-to-end approach, though. It's not just the NHS. It's people aren't studying this. People aren't. It's too expensive for people to go to university and to study this and for this to be their career. So there's a skills gap, and so it's. People are like, oh, well, you never have to pay off your university. But it's off-putting to some people, and it means that the resource might not be able to be covered. And again, it's lies. The fault lies with the government.
And I think a lot has been made about the ring fencing. We had Norman Lamb on the programme talking about this a few weeks ago, talking about ring fencing the spend so that when you do have extra money set aside, that it's actually then ring fenced for it as well. The government will say, 21,000 jobs will be created from a mental health point of view between now and 2021. I guess, Mike, young people who are included in these figures, I guess the danger is that if they're not helped now, that actually when those 21,000 jobs or however many jobs come on board in the next 3 to 5 years, actually it's those young people with wider issues later in life who become the focus of those jobs. Whereas actually when it's young people, there's a much greater sense that if you can speak to them, if you can get them into the right services, get the right assessments early on, then those problems in later life might not emerge in the way that they do.
And that's where there's a couple of points that have been raised in this so far. As first of all, it's the resources that are out there are stretched as it is, and so actually you can't get the services that you want that people actually need in order to do the job that's needed to be done. The second point really is just that we're trying to get our young people in. You see it in school all the time, as where you'll see the height of their anxiety, the height of their mental instability in some cases because of the amount of pressure that's being put on them. And if we don't deal with it, and that's what Peter was talking about before with that resilience side of things, if we don't deal with the actual root of the problem, then you're always going to have these stretched services. And almost when it comes to school and dealing with people like CAMS and other organisations that are out there, you're almost just trying to paper over the cracks. You're just trying, let's just get this, sort this problem, not actually the root of what we're getting to. And it's a big. I was thinking about this the other night, actually, almost the oxymoron that is a young person's life, of where they've got more stress, more anxiety, and more problem than they've ever seen before, and yet actually, I sometimes miss the innocence of being youth, of not actually understanding where that stress comes from or what happens as a result of that, and the unknown of it. And it's a massive mix that goes on in a young person's life. And we're as a teacher, I'm preparing students for jobs that just don't exist yet, that may not have even been thought of yet. How do you prepare someone for a life that you don't really actually know what's going to happen in that life yet? And that's where you've got to deal with the resilience. You've got to deal with the skill of being able to be flexible and adapt and strengthen your own personality to do that.
On that point, and we always say, treat mental health like physical health. But if people kept getting hit by cars and were breaking their legs all the time, we go, right, we need to build more hospitals to treat all the people with broken legs. But equally, you could also look and go, right, why do people keep getting hit by cars and are breaking their legs as well? And often the way of dealing with the broken legs in the first place is cheaper than having to find the bricks and mortar to build the hospital.
I agree with that.
I think the biggest impact in terms of a solution is way before treatment. This is about prevent. This is about helping young people to develop themselves in a way that means they've got greater mental stability. And I think the responsibility for that lies with so many different services. That's in education, that is in healthcare, that is in the third sector. It's at home as well. It's upon us all to make sure that young people have an environment in which they can grow up with strength of mind.
And it's bigger than that also, because if you think of the kind of things that are pressures on young children these days, things like the internet and social networks and bullying on there. So you could say that, well, Facebook and Twitter and Instagram, they have a responsibility. First of all, they should be monitoring that people on the site are the age that they say they are, because I know I think you have to be 16 or up, and that's just...
I think some are 13.
Some are 13 with parents' permission. But, there's a culture around there which has created... It's great, it's great in terms of what it's done for progressing technology in the world, but it's also created all of this stress that we've never had to deal with before. And things like divorce rates, like people are getting divorced, like never, and kids quite often will not get picked up in that. So if you've got two parents both not having a great time, where's your support? How do you deal with that? It's things, that's the bits to look at.
Peter, you mentioned the word resilience, and resilience is in my book now, it's heading down the word of tolerance, and like people say, you need to be more tolerant in the way that, like, if someone, lets off in a lift, you tolerate the smell until you're able to get off. Like,
what an example.
I was just going to say.
Where did that come
Is this a recent example when you came in work today?
People go, we need to be more tolerant, but tolerant is not a great word.
I wouldn't be tolerant of that.
No.
I'd just like to say, I think that's really rude.
Resilience is another of those as well, where sometimes there's an idea we need to make children more resilient. But I almost think, well, more resilient so they can take on the things that are coming their way. But can we not change the emphasis of what's actually being thrown at
So
them?
I think it's both. So I liken resilience to a balloon, right? And so when you balloon,
hang on, I've gone down a lift, right?
When you balloon,
you've got a balloon, right?
When
balloon in a lift.
When your balloon's inflated, stuff will hit it and bounce off the balloon, right? But every time it gets hit, it becomes slightly less inflated, and you get to the point where stuff just doesn't bounce off the balloon. And I think resilience is a bit like that. So if you teach and support young people to develop their own resilience and to know when they need to reinflate their balloon, I think that helps. That doesn't mean to say we shouldn't also be trying to deal with the things that hit them. And I think social media is a great example of one of those things.
I preferred the fart one. I said no. I absolutely take it, but there's a resilience thing, isn't there? Where you think, where you want to be able to have a little deflector shield that a kid can have, but you don't want them pouring concrete into walls around them just to be able to take on what life throws at them, Mike.
Well, there's so many. I'm confused which metaphor we're on at the minute. I'll be honest with you. Start a new one. No, I always like to just keep things simple in the fact that yes, we do need to remember that these are children. We are putting a lot more pressure on them, and we have to tail that back. But it is, and I do sort of get the point, it's slightly different to tolerance in my mind, of whether you tolerate actions that happen. But it's all about their own mental well-being, their own characteristic of being able to understand why something is happening and understand the appropriate ways in which to deal with it, whether it be... So I know for me in the classroom, if I'm getting really ratty, it's usually because I've not been outdoors for a while and I've not just had that open space. Classroom can be quite confining to people. And I know all I need to do is get out of that classroom a little bit, get into a bit of outdoors, and I'm usually a lot better, a lot fine. I've had that time to think about it. Using little strategies like that, or trying to find what it is in that young person to help them deal with the amount of issues that are coming around them. Because at the end of the day, as a school and as a society, you are trying to support them for later on in life. There is a big unknown, as we said before.
Do young people now know that they have mental health?
Yeah, I think so.
Do they get told to almost consider their mental health? Because that
I
for a
don't
lot
think
of
it's
people,
a big thing.
But for a lot of
it
people,
should be. It
that's
should
the
be
link
more.
that they need to make. They'll go, what is this mental health thing? You're all depressed. You're all anxious.
I don't know when it's too late.
I don't think the term mental health is widely used, but I know, I'll use it as an example because I've worked really closely with them. But Childline have used their technology they have constant chats, and they have an amazing website for kids to go and talk about their feelings. And mental health feels a bit too clinical, but they're very aware of their feelings and they're very aware of how to express them. And it might not be in the adult way that we would. They have the opportunity to draw a picture and use silly stickers and stuff like that. But it gets them talking about emotions and how they feel and issues that they have. So maybe mental health isn't the phrase that we've used, but I think they're aware that if they have feelings and they're not feelings they want, that they can talk to someone about it.
I don't think they get the opportunity to talk about it early enough in life and to develop the coping mechanisms to try and give them the best chance later on. They tend to talk about it when they're suffering and when they've got issues and when they need support.
That's everything, isn't it? That's I think that's predominant across the board. Like, it's just if someone has a mental health in particular, it's not until it becomes to a stage where it's critical, or you go and see someone, and maybe also on the flip side, it wouldn't get treated as serious because you'd be like, oh well, you're not depressed, you're just a bit down. So that's a societal thing.
But I think society learns from its mistakes. So if you think about all the things that have damaged people over the years, those things will tend to be talked about with young people at some point, whether that's in education or something else that they do. So whether it's the use of alcohol, whether it's safe sex, whatever it is. And I think mental health and developing a stronger mental well-being is something society will learn from and realise it needs to put in somehow to education and other areas.
Well, to bring that full circle then, I guess, if you had a bit of a cut on your knee and it started getting a little bit scabby, then it went a funny colour, and then suddenly, you went to a hospital and he said you're going to have to, lose your leg or something like that, those services would be there. But actually, what this is suggesting is that a young person feels a bit down and actually starts to feel a little bit depressed and actually feels like there's a long-term issue. What this story is saying, that the point at which they would go to hospital, have your knee amputated, when they might be waiting 35 days, they might be waiting a year and a half before that treatment's in there.
And that is sadly typical, those very long, and again, it takes you back to the point the resource isn't there. It's there's not one quick fix. It's not about put a load of money in this area. It's every single area needs to be addressed, and it's an education for just the way that we deal with kids in general.
That's a review finding 4 in 10 mental health services for children are failing and they're facing long delays for treatment. The Care Quality Commission says the service youngsters get in England varies across the country. Some get seen within 35 days, whereas others can wait for a year and a half.
Radio City Talk. Tackling the stigma.
Now, thanks to Peter Oliver, who works within the Scouts. We had Mike Hussey, who's a school teacher, and also Steph Heneghan from the Rider podcast discussing that matter here as part of Mental Health Monday on Radio City Talk. We also got reaction as well from the Wavertree MP and somebody who's a very prominent voice when it comes to mental health, Luciana Berger. She offered our reporter Adam Phillips her thoughts on these statistics.
Indeed, so this is yet another report that's come out today from, this time, the Care Quality Commission, doing an overview of not only the services that they have responsibility for inspecting, but looking at the whole range of young people's mental health services. And what they found is, not a surprise, that there's a massive variation in the time that young people are having to wait to access services, that they are having to travel really long distances if they need specialist care. And there's a real very significant issue. Whereas the majority of services are very good, there's still too many services, in my view, that require improvement or, in fact, are inadequate. And we seriously need to address that as well.
How long have you heard of young people waiting for the right treatment, the right services here on Merseyside then?
Well, as a local constituency MP, obviously I hear first and foremost from my constituents that I represent, but I also have a national picture as well, because I have a role within the Labour Party as the president of Labour's campaign for mental health. So I've got a very national picture as well. It's fair to say locally we're not doing great, and it's just in the last week I've had constituents that have come to see me whose children have had to wait up to 6 months just to get an assessment. I also received an email from a teacher just in the past few days. This is a teacher in a primary school, a local primary school, who outlined some very severe cases, in my view, of young people under the age of 11 who were suffering with their mental health. And for each of those 3 young people, on their very specific circumstances, they were actually rejected. They were knocked back. Their referral essentially did not lead to those young people entering treatment, and that is very, very worrying as well. Now, I know that within the city, and in fact across the country, the people working in young people's mental health services are incredibly dedicated. They do a really, really phenomenal job when they're given the opportunity to do so. And part of the challenge is that the resources aren't available to make sure that they can do their very best to help young people in a timely fashion and to give them all the attention that they need and deserve.
How does that make you feel, hearing that people have waited as long as 6 months just to even get an appointment here in the city?
Well, it's devastating. It really is really, really horrendous. And it's horrendous for all those young people that have to wait. It's horrendous also because we know that it will have an impact on how they feel. And it means more than likely that they'll actually be more severe when they actually do access help. That doesn't make sense for them. It also doesn't make sense for their recovery, and it doesn't make sense for the impact it could have into their adult life. We know the overwhelming majority of adults with a mental health condition will have developed it as a young person. It just doesn't make sense that we don't help young people earlier on in a really quick way and in the best way possible, because the long-term consequences and the cost of those consequences, in fact, not only to those individuals and their families and their life chances and their life outcomes, but also to our economy, are massive. So this whole thing just doesn't make sense in my view.
Are lives being put at risk for the fact that they're waiting so long to get the right treatments?
Well, we have to be very careful, about how we, assess that proposal and whether that is true. In fact, there have been some cases where we know that it has been like last chance saloon in terms of people accessing services, and in fact it was over the summer that our most senior family court judge intervened and actually wrote to the Home Secretary and other government ministers on behalf of a girl, a 17-year-old girl who was named Girl X, who was in the most inappropriate setting for her level of need and had been restrained over 100 times. And there was very, very concerning views about what the impact on her mental health was going to be if she didn't access the adequate and appropriate care. There's no evidence that I've seen that would be the case, but we've seen it in adult cases. And so every life is precious, and no life should be treated differently, and we shouldn't be treating mental health any differently from physical health. And unfortunately, what this report shows today is that, unfortunately, is what is happening.
Do you think this report also shows that people are facing a postcode lottery when it comes to their mental health services?
Well, it's one of the key themes of the report, of what they call variance, that there's such a massive variation in the times that young people are having to wait across the country to access services. Again, it's about decisions that are being made locally, but in my view, what would make the greatest difference to address this inequality and to address these long waits that some young people are having to experience in order to access services is to ensure that the money that the government says they make available centrally has to be ring-fenced locally. And at the moment, there's nothing to actually ensure that the money that government says that they're putting into young people's mental health actually reaches the front line. And I want that money protected. I don't think it's a lot to ask. At the moment, it's a very low priority. It's in what's called the NHS planning guidance that local areas should make sure that more money goes into mental health, but there's nothing to hold them to account to ensure that it really, really does. And there's a really important opportunity coming up with the budget. In a few weeks' time, the Chancellor will tell us how he's going to what he's going to do with the nation's money and how it's going to be spent and where it's going to go. And the money that goes to our National Health Service and the money that they say they're going to put into mental health in particular, I want all of that money to be protected and to have what's called a ring fence put around it for both adults' mental health and children's young people's mental health services, to ensure that it really properly reaches the front line. Because it's not right that here in our city, £750,000 has been cut from our young people's mental health services. It's not just here in Liverpool; it's happening right across the country. And I want to ensure that that money is protected and really reaches the front line to help as many young people as possible, so they have the best chance and the best start for the rest of their lives.
Luciana Berger speaking to Adam Phillips. It's Mental Health Monday on Radio City Talk. Going to take a look at a story now, which is based around addiction. It's based around gambling, and it's also based, unfortunately, around suicide. I was joined in the studio by John Myers. He is a dad from Huyton, and unfortunately, John lost his son, Ryan, to suicide. Subsequently, he discovered that Ryan had actually been running up some major debts when it came to gambling and problem gambling that the family hadn't been made aware of. And John's now calling for changes to regulations and laws around whether or not people should be exposed to gambling in the way they currently are in society. Let's take a listen to John Myers and his story. He explained what Ryan was like.
Ryan was a lovely lad. I mean, people say that, parents do say that our lad was a lovely lad, but Ryan was liked by everybody. I couldn't think of anybody who didn't like him. He was very self-effacing. He could laugh at himself. He could joke about himself and everything, you know what I mean? And there didn't seem to be any problems. He was just a normal lad. He had a job. He had his own house. Well, he rented a house, you know what I mean? He played golf, he played pool, played darts, enjoyed a lot of sports. Really, like I say, very happy-go-lucky lad. We went on holiday in Turkey. We had a week's holiday, and again, he was just himself, because even though at the start of the holiday it wasn't as good because the hotel we had wasn't very good, he still took it all in his stride and still was happy and kept everybody smiling and happy and jovial, like, you know what I mean. And we came home on the early hours of the Friday morning. My wife Alison phoned him on Saturday. He was his usual happy self. He said he'd been doing all his washing, getting himself ready for work, and you know, the normal stuff. And then on Sunday he put a message on social media which frightened us a little bit. We tried to get in touch with him. We couldn't get in touch with him. We got in touch with people who lived close by and asked them to go around. And as we were on the way down there, my phone went and it was his number. And I turned to my wife Alison and I said, yeah, he's just phoning us up. But it wasn't. It was somebody to tell us to get down there as soon as possible. And when we got down there, the ambulance was there, the police was there, and everything. And that's when we got told that he'd hung himself.
The fact that you had no sign of it whatsoever, I mean, I guess from a parent's point of view, you know, you didn't realise there was a problem. And then to experience that, the shock of that must have been unreal.
It is, because we always said that if it had been a car crash, if it had been an illness, you've got something to focus on. We had nothing to focus on at the time because we couldn't understand why. The questions were why. And then when we were in the house and the police was upstairs and everything, somebody noticed a betting slip on the floor. And that was the first time we really thought of anything, because when we looked at it, his card had been declined. And after looking into it, we found out that he'd been out that day and he'd spent all his wages. It looks like he'd been on his way home. He's gone to make another bet. I think he's then realised what he's done. We've since found out it wasn't the first time that he did it. And in a fit of pique, he's done what he's done. We believe that if we'd have been able to get in touch with him, or if somebody had spoken to him, he may have stepped back from it. But because he was there on his own, he did what he did. You know what I mean? Which is... which has just devastated us.
As you then looked into the circumstances of his finances and the way that he'd been betting and gambling, what sort of things did you uncover? What sort of figures would we be talking about there that he was involved in?
Our Ryan was always careful with his money. He always had savings and, you know, stuff like that. And he didn't, you know, I wouldn't say he didn't spend money, but he was always very careful in himself. So much for that. You know what I mean? I'm not paying that and all that. Like, so we thought everything was fine, but when we looked into it, he had no savings left. You know what I mean? Like I say, we know we'd got paid the Friday because while we was in Turkey, he was getting in touch with his works to say they hadn't paid him correctly, and he said the money would be in. So we know that money was in there. And we know another time we've managed to get onto his Facebook account and things like that, and we started looking, and he was talking to a guy called James Pedrick, who does a diary of a problem gambler. And with his conversations with him, we saw that he had done it before, where he'd spent all his money. He'd got a payday loan. We found something from pawnbrokers, but we can't be sure what he actually did with that. We know he had a loan out with the bank, but we still don't know exactly how much over a period of time it come to. But like I say, he loved his van as well. He had a works van and he fitted it out himself. And with hindsight, you know, you think about these things. He wanted to sell his van just after Christmas, and we found out that just before Christmas is one of the times when he'd lost all his money, and he loved Christmas, so he must have been looking to get money, and so he could sell his van and then get a works van rather than have his own van.
I mean, when you were uncovering this sort of after the event of Ryan's death, was that troubling for you to get a sense that there was another story to Ryan's life? There was another aspect of his life which you'd previously been unaware of, things that he was going through and experiencing that he kept to himself.
I think because hopefully the way we brought him up and things like that, I think because he had this terrible addiction, he was ashamed of it, so he didn't want to tell anybody, so he did keep it to himself. And to be honest, when we look at it, he did sort of pigeonhole things in his life. He had his family, he had his work, he had the people he played pool with and golf with, and these people didn't know each other because that was his little social group, and that's the way he was. So this was another thing that he had that he was ashamed of, that he was trying to hide, and he sort of pigeonholed that in his own little place. And instead, like I say, it was only money in the end. If it had come to me, we could have sorted it out. It wouldn't have been a problem. But to him, it was, because he was always a perfectionist. You know what I mean? He was a carpenter, and he was a good carpenter. We spoke to his bosses and his people at work and said he was one of the best carpenters they knew. So he liked perfection. Like I always tell a story about, he actually worked on the Aintree Festival, and he was just building bars. And everybody else, he came home, he said, "I don't like it, Dad." I said, "Why?" He said, "All the bars are flimsy." He said, "I started making my bars are good, like, and then the guy came up to me and said, "What are you doing?" I said, "No, don't do it like that, do it simple, because we have to knock them down straight away." And he didn't like that. So, you know what I mean, he was a perfectionist. It showed me things that he'd done, you know what I mean? Look, I did this, I did that. And I think because this was a problem and it made him seem less perfect, I think he was really ashamed of it. And I think in the end, that's what did him. He just felt so ashamed of himself.
John's story there on Radio City Talk. We really appreciate him coming on and sharing that story with us on the programme as well. Such tragic circumstances as well. He's asking people to sign a petition. We'll get the links up on our social media at Radio City Talk.
And I'm Connor Phillips. On Monday, I spoke to John Barry, who is a male psychologist and author of the Masculinity Report.
Mental Health Monday on Radio City Talk. Tackling the stigma.
The Harry's Masculinity Report, conducted by University College London, Harry's being an American grooming company, found that men are now more concerned about their mental health than their physical health. The Harry's Masculinity Report spoke to more than 2,000 men in the UK and found 44% of them think that their mental health is important. And I'd like to welcome to the show a male psychologist, John Barry, who I suppose it was all across the Masculinity Report. John, is this good news for you? Do you think that more men need to be actively and openly talking about this, or is this sample of 2,000 people just maybe a little bit too small to be, I suppose, overtly general about it?
Hi, Connor. Thanks for inviting me on the show. I was kind of surprised by this finding too. I don't think the sample is too small. I think it's quite a big sample as they go. Can we generalise it to other men? I would expect so. I mean, we have all the regions of the UK and Ireland are represented here. I think it's good news because, I guess, I mean, men have got serious mental health problems that they're facing. 3/4 of the suicides are by men. But men don't tend to go to therapy for psychological problems as much as women do. So if men are starting to recognise that the mental health is an important thing, it's really kind of, it's about time, really, because something needs to happen.
The study says that men now think, and the 44% of the men think, their mental health is very important. Again, a bit of a general comment. You can think your mental health is very important and subsequently do nothing about it. It's that whole thing that some men, well, it's very important to be healthy and then never go to the doctor.
Yeah. Well, there's something in that. I think in some ways we have to be careful about what some people call victim blaming. I think men kind of don't go to seek therapists out for their mental health issues. And I think that's not all the fault of men. I think as psychologists and counsellors and psychotherapists, we have to look a bit more closely at whether what we're offering to men as a mental health solution is actually the kind of thing that men want to engage in. And some other research that I've done a few different studies has found that men and women are slightly different in how they want to deal with their mental health problems. So whereas women want to talk when they're distressed about something, they do want to talk about their feelings. That's one of the main things they want to do. And this is speaking in kind of broad brushstrokes, generalization. So it's not everybody, but men are by and large are different. Men want to have a kind of a step-by-step rational solution to their problem. They don't necessarily, they might benefit from talking about their feelings, but it's not the kind of thing that really inspires them to go along and fix their problem.
When you are able to differentiate between what men and women are like as a male psychologist, is it then, and does it become your job to try and instill this in the NHS, in the Irish system that I'm just gonna surmise here? I can tell from your accent you've clearly worked in before. Is that then the psychologist's jobs and people who come up with surveys like this to go, actually, hold on, it's not one rule for all. We need to make sure that we're approaching this from different levels, or has that already started?
Conor, you hit the nail on the head with this. I mean, it's really the duty of psychologists and other mental health professionals to recognise that we're not really doing enough. We are doing a one-size-fits-all approach. And actually, if that's not quite fair, I mean, like therapies do vary in how much they are. Say, for example, if you take psychodynamic psychotherapy, you will have a lot of talking about your feelings and a lot of talking about your childhood and lots of the things that men don't really see as being the way forward to solve their problems. But then there are things like CBT, which is a bit more solution focused. So I can't it's not really quite one size fits all. But we're not taking that extra step in really being a bit creative in imagining how we might be able to do things a bit differently. So things that we found in this Harry's report that are kind of quite useful in pointing the way forward to helping men with their mental health problems. And it's good that men are actually recognising that they do have mental health problems. Like there are things like men's mental positivity. We measured something called their positive mindset, which is a kind of a combination of their optimism, their mental stability, how happy they are, how confident they are, how in control they feel, how motivated they feel. When we looked at the kind of things that predict how positive their mindset is, we found that things like engaging in sports was something that was associated with a more positive mindset.
Hugely.
And so, I mean, to you, that might seem obvious. A lot of football fans, that's obvious. Tell that to a mental health professional, they'll think you've gone a bit mad. And I think that this is one of the problems. We've got a kind of a mental health service and an academia kind of supporting it, that is a bit what's called gender blind. We tend not to see. It's almost like it's a bit indelicate to kind of suggest that men and women might be different in some ways. And of course, we can all agree that by and large, men and women are very similar. But actually, it's the kind of the small differences that might make all the difference. And I think that's what we've got to look at here. It is the small differences. We have to be brave enough to be called politically incorrect and say, look, okay, well, if men, by and large, get mental health benefits from going and watching, say, Everton versus Liverpool, which is going to be a brilliant match, who wouldn't get a mental health benefit from that, except maybe the losing side? But if men are inclined to do that, and it's good for their mental health, we should encourage men to do those things.
You're listening to Radio City Talk. I'm Conor Phillips on Mental Health Monday. John Barry joins me, who's a male psychologist. And we're just talking about the masculinity report, which is about 2,000 men who were surveyed by Harry's and the University College in London about who seen mental health as an importance, and 44% of people did. Just one, I suppose, one caveat to the positivity here, John, is that for those who aren't actively seeking to talk and speak about this, here in Radio City Talk, we're so positive about trying to get people to talk about mental health issues. For those who work within health services and see exercise as just in itself, getting away from exercise and the benefit it has to mental health, but exercise being the thing that we should all be physically looking out to do. Now, this survey has said that 44% of males think their mental health is important, where 37% said their physical health is important. Do you appreciate this study might have some detractors and doubters from those who say, listen, you have to go and get your physical health sorted first? And is this a frustration for you as a psychologist?
I suppose it is a frustration because I haven't had anybody say that yet, but I can understand why they might do. But it isn't a competition between mental health and physical health. I mean, there's like our mental health benefits from our physical exercise, and I'm sure the physical exercise. I mean, there's all sorts of benefits that we can get from any of these things. It's not a competition.
Yeah, I think that's a really good point, that it's not a competition. I think that, specifically what you said there now about football, not only actually physically watching it, but also playing it as well. The combination of good mental and physical health, one's not mutually exclusive from the other.
Mm-hmm. And I think men are going to be more inclined, probably everybody is, to do physical exercises that make them feel good. So it's like if you're told to go to the gym and actually you don't want to go to the gym, you'd much rather kind of cycle around in the countryside or like up a mountain or something like that. Well, then you're going to do more of that because you'll do more of the physical exercise because you get a mental health benefit out of doing it.
So I'm looking at CAM here. I'm looking at the Male Psychology Network here as well, and I suppose I'm looking you to point those who are listening at the moment in the right direction here. Should anybody be listening and think that they are suffering at the moment, suffering in silence? One of the big things about this show, specifically Mental Health Monday, is to detach the stigma from mental health problems. It can be anything from 3 and 4 of us will deal with this at some stage in our life. Where could we be looking? What advice do you have for anybody who may be struggling at the moment? And I suppose we're looking to see if we can enhance and develop surveys like this even further.
Well, the kind of advice I'd say is, one of the things that you tend to get, CAM are great, and so does Samaritans, lots of things. Childline have got a new thing focused at boys' problems, but they all tend to say the same thing, which is very well-meaning, which is you got to talk to us, you got to talk more, and that's true. But like just saying that to men isn't the thing that's necessarily going to help them. Now, some other research, not this Harry's report, have found that there's all sorts of different ways that men might improve their mental health. I'm thinking in particular going to the pub with your friends, having a couple of drinks, not going out and getting completely hammered, that's a different thing, but just having a kind of social drink with your friends. A couple of studies, one at University of Glasgow and also Oxford, have found that lots of men do benefit from that. So I don't think you necessarily have to talk to a mental health professional, and you don't have to just sort of pick up the phone and start really kind of talking about your feelings. I think you just need to start kind of maybe talking a bit with your mates. Like a lot of the problem is people are socially isolated, so kind of getting out of the house and kind of going to a football match, or getting out of the house and meeting a friend you haven't seen for a while, have a couple of drinks and just sort of chat, see how you're both doing. I mean, that can do everybody the world of good. And
just very quickly on that, have you found in your own experience that those who maybe were a little bit hesitant to talk to male friends, that they've been surprised by the way in which they're, I suppose, brought in and the arm does go around them psychologically and physically sometimes, and maybe they didn't think that was going to be a situation?
It can definitely help. I mean, I think you have to be careful about raising people's hopes too much, because sometimes men and women don't really know what to say. But just bringing it back to the mental health professionals, I think that we need to be a bit more creative about the kind of services that we offer, so that if men, for example, kind of do get more benefit from going to the gym because they would refuse to see a counsellor, well then maybe we can kind of offer on the NHS sort of gyms that are sort of mental health friendly, where you have somebody at the gym who actually maybe is trained by Samaritans, knows how to because Samaritans now have had training by a really brilliant clinical psychologist called Martin Seeger in how to deal with men. Because lots of psychologists, like a kind of a friend who doesn't respond very well to hearing a problem, lots of psychologists kind of when they listen to a bloke, you might kind of engage in a bit of banter at the beginning of a session, and lots of therapists think, well, this guy's not taking therapy seriously, and it's partly. I think empathy is just a brilliant thing for everybody. We all have to kind of develop a sense of kind of understanding, and part of that's got to come from psychologists. We have to understand where men are coming from. And lots of men, they don't want to talk about their feelings. They do like to engage in a bit of banter. I mean, banter's got a really terrible name, but, just lots of guys do it. Why can't we just accept that and sort of let them kind of talk a bit, and maybe that'll lead to something of a kind of better therapeutic relationship than insisting that everyone just starts talking about how they felt about their parents or whatever sort of thing that a therapist might be expecting.
Yeah, I couldn't agree more. It happened in my own life. A friend of mine, we were very unlucky in a group of friends of ours to lose an individual to suicide, and another friend of mine. Okay. It became the forum in which he was to say, look, lads, I'm struggling. And I had a subsequent chat to him about that. And he says, look, that conversation was he was able to say, lads, I'm struggling. I could do it a bit of a hand here. Was better to him than many, many different avenues. Not for 1 second saying that you shouldn't address those other avenues. Each case is very different indeed. John Barry, listen, thank you very much for your time. We really do appreciate it here on Mental Health Monday.
Radio City Talk. Tackling the stigma.
Thanks for your time today on Mental Health Monday. Show back next Monday as well. We've got loads of special guests lined up pretty much between now and Christmas. If you're listening as part of the podcast, thank you for checking us out and downloading us. And there'll be another podcast next week. All the previous episodes are all available online. Simply type in Mental Health Monday podcast. You'll get a link to all the podcasts through any search engine. And there's 40 odd episodes for you to check out. Mental Health Monday on Radio City Talk. Drop us your emails, mick@radiocity.co.uk.
Radio City Talks Mental Health Monday with Mick Coyle.